Thank you. So I have to say, actually, there was a little bit of confusion when I sent my credentials in. Medical Hypnosis Consultants is my own company, and the study I'm going to talk about was done in conjunction with Duke. Somebody at Duke and myself put together and got we got funding from the I have to start out by telling you, I just got in yesterday. I'm not sure I know my own name. So 33 hours from leaving my home to getting to my hotel. So if I seem a little bit out of sync, I apologize, because I am definitely jet lagged. When I woke up this morning, I'm like, oh my God, I wish I was presenting tomorrow. But so the Susan Komen Breast Cancer Foundation funded the study. I did the design of a program for cancer patients, breast cancer patients in particular, and then we did it through Duke's patients. So that's where the Duke affiliation comes. I actually did teach at Duke for 15 years for the med school, but it had nothing to do with the study you're going to hear about. So anyway, so enhancing the quality of life of breast cancer patients with self-hypnosis is the study that I did. And I've been doing hypnosis. Am I hitting the wrong button or what? There we go. Oh, now it's going to go twice. Of course. Go back. Huh. Okay. This isn't my jet lag. This is the... There we go. So I did a study that was published in the American Journal of Clinical Hypnosis in July. And that was in a special issue of the journal that the entire journal was on the benefits of hypnosis in cancer care. And I was the guest editor of the journal. So what I have done, I have these little sheets that I can pass around so you all can take with you. I was a graduate professor for 20 years. I give handouts. So there's three links on here. The first one is to the actual article right there. And you can put that in and get a link to the full article. The second is a link to the editorial that I wrote, which gives you a summary of each of the other articles. So you can see, do I want to read that one or not? The third is a link to a 2-minute video of surgery with no anesthesia and no bleeding, but with self-hypnosis only, that you're allowed to use and share, and it's of me. So I thought you might find that fun. So I don't know, how do we want to distribute these? Just start them up front, or you want to? Okay. Anyway, so I thought that you'd have some info to take home with you, because hypnosis is an incredible tool that most people don't know much about. I did check also to tell you, so the American Society of Clinical Hypnosis is an organization where you have to have a license in a healthcare field before you can actually be certified to do hypnosis and even do training with them. I checked to see about New Zealand, and I found 2 different hypnosis places that said they do clinical hypnosis in New Zealand. I couldn't really tell, though, what kind of qualifications were involved. I was trying to go through the web pages, and I'm not sure that the training and credentialing is quite the same, so I wasn't sure. So I didn't list any particular group that I would refer you to as who to go to here, because I wasn't sure who's the equivalent. But what you want to look for if you're going to go to somebody to learn to do some self-hypnosis or do hypnosis is where they were trained, what kind of training they have in hypnosis. But even more important than that, because my training says hypnosis is not a field in and of itself, you want to know what their healthcare provider status is. So I'm a licensed professional counselor. So I am licensed by my state. Then I have the hypnosis that I use in conjunction with that to help people both in psychotherapy as well as for medical hypnosis things. Does that make sense? So if you're going to be looking to do any of this, that's what you want to look for, is what is their credential. There's a lot of people out there training people in hypnosis that are parts of, like in America, the largest trainer of people for hypnosis is a division of the Stage Actors Guild. So you really want to sort through this, because it's an incredibly wonderful skill, but not everybody is equally trained to offer it. Is there some direction I should be pointing this? Oh, that way. Okay. So the intervention that I did was we took breast cancer patients, because Komen Breast Cancer Group was funding it. So at the beginning, we just used breast cancer patients. The intervention was I designed 4 week-long classes. So it was an hour and a half once a week for 4 weeks that people came to self-hypnosis classes. And then in addition to that, they had one 45-minute session with me individually, which we now only do about 30 minutes, really. We found that all it really needs, because once they've learned about hypnosis, they kind of come in with a list of things they want to work on, and I make them a audio tape specifically, or audio, it used to be tapes, and it was CDs, and now it's electronic digital recording. that we send them that is for whatever specific things they're wanting to work on. And this will all make a little more sense as I go through. So we use the functional assessment of cancer therapy, the FACT-B for breast cancer patients, to measure pre-post intervention. It's 36 items, and it's a self-report instrument. I'm going to go through, that's what I'm pointing at. Okay, now I got it, guys. It's got 5 categories, and I'm going to go through this study really quick, because this is probably not near as interesting to you as what hypnosis really is, right? Okay. So we found that significant changes were reported in 16 out of the 36 measures on this. One of the categories, physical well-being, less trouble meeting their family needs. They felt they were less bothered by the side effects of treatment. They felt less ill. An emotional well-being category, they felt less sad. There we go. Less nervous. They were experiencing less fear of dying. They were less worried that their condition would get worse. Under the social and family well-being category, we didn't find any significant changes at all. And this one, we didn't expect to find any, because this is about my husband is supportive. My, sibling, or my kids are, taking care of me, or whatever the questions are that has to do with other people. So we didn't expect to impact anything on these 9 items, because it had nothing to do with the people in the room with us. Does that make sense? Is the battery getting low? Maybe the battery's dying. So under the functional well-being category, they found that they were more able to enjoy life, more able to sleep well. There we go. More able to enjoy the things they usually do for fun. More content with the quality of their life, which is hugely important. I mean, as many of you in this room know, going through cancer treatment, either yourselves or with a loved one, your life becomes sort of this treadmill that you're on that seems to not stop, and you're running from place to place and getting scheduled for all kinds of different treatments or appointments. And it can really be very frustrating, and the quality of your life seems to change pretty dramatically in terms of the things that you like to do. And so we found that people who learned how to do self-hypnosis did so much better and felt like they actually were able to do more of the things they loved and liked. So additional concerns, this particular category is, I'm going to just bring these up, is for just breast cancer patients. It was the questions for breast cancer patients that aren't there for other cancer patients. And so they were less short of breath. Interestingly enough, following the last talk, they had less swelling or tenderness in their arms. Whoops, I went too fast on that one then. Less worried about the effect of the stress on their illness, and felt more sexually attractive and felt more like a woman. Isn't that somewhere in there? There we go. I'm sorry. I hate PowerPoint. How about the rest of you? Then I'm going to teach you the definitions of what is hypnosis. This is what in the way that we taught it to the patients. These definitions are in the article. If you want to bring that article up and look at the way these are exactly worded, they're right there. So basically, we taught them that hypnosis is a tool or process that is used to facilitate going into trance. I really do think this battery's dying. Is that possible? It enables us to control when we go into trance and how we can best utilize it. So trance then becomes really the more, whoops, I missed a whole slide in there, didn't I? Oh, it's one of many tools to go into trance. So when we talk about trance, hypnosis is not the only way to go into trance. Trance is a naturally occurring phenomena. So some of the things that, have any of you ever been daydreaming? Okay, so daydreaming is a trance state. Mindfulness meditation, contemplative prayer, ritualistic drumming, chanting, all of those are things that can take you into trance. Okay? How you get there and what you do with them once you're there is what difference between each of those things. All right, so then trance becomes really important. It's a naturally occurring phenomena. And it's an altered state of consciousness is the definition that we use. There's lots of different definitions if you go and read the literature. This is the one that made the most sense to us because we think all the other definitions seem to fit within this one. So it's an altered state of consciousness in which one is more able to readily access both psychological as well as physiological abilities. So if I can just take a second, when I say altered state of consciousness, if conscious mind is up here and conscious mind is, all that information readily available to you, subconscious is just below the surface. That's like when you have to take a minute to pull out information, like what's that guy's name, or what I had for dinner last night or 2 days ago. Unconscious is information way in the background. So can you tell me what you got for your 6th birthday? Most people can't. But anything significant is stored, so that's probably way in the background there somewhere. Now, if you think about a computer, and I'm going to just collapse conscious and subconscious here in a minute. Conscious mind is like that window right in front of you. All the information is available. Subconscious is like the window 5 back. Click, 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 takes a few moments, but you can get to it. The unconscious is like the hard drive. You need some special tool or program to get the information off the hard drive. Okay? Now, the hard drive does something else besides store information. It controls the entire operating system. So your hard drive is storing information, and it controls this operating system. A lot of people equate the unconscious mind from this hypnotic perspective to the base brain, where all the autonomic systems operate from. So what you're doing when you say altered state of consciousness is you're just quieting down the conscious mind. I'm lumping conscious and subconscious together because that's all the information available. You're just quieting one down and bringing up the other. So rather than being less in control in trance, you're more in control because you can access the resources of the conscious mind as well as the unconscious mind. Suggestion is the third definition we're going to talk about in a second, and it's basically how do you talk to the unconscious mind and tell it what you need to do. Does that make sense? So that's all hypnosis is. Suggestion, this is just examples of naturally occurring trance. We kind of talked about that a little bit. Suggestion then is the vehicle through which we communicate messages to the unconscious mind. There we go. And when you're in trance, one's ability to accept suggestions are heightened. So that's why we go into trance, is to be able to talk to the unconscious mind with that ability to really take those suggestions down into us and the parts of us that can utilize them. So the power of suggestion, you all ever heard that phrase before? You're given and receive suggestions all the time, some unfortunate ones from people. Sometimes your medical providers say things they don't really mean. Going back to the last person who talked about lymphedema, I had this woman in one of the first groups I ran who said she was there at that group because every morning she would wake up and look at her hands to see which one was larger. And I thought, that's an interesting thing to do. And I said, well, tell me more about that. She said, and she had been, we took people, they had to have at least have had surgery, and then they could either be doing radiation and chemo, or they could have finished all of their treatments to be in the program. Most people were still in treatment. This woman was 5 years post-treatment, and every day for 5 years, she'd been waking up to stare at her hands. She said because her doctor said, you need to look out because you could get lymphedema at any time. So every day she woke up to see. I don't think that's really what her doctor meant, but it is kind of what he said. So it's kind of how things are worded can often, you kind of need to see what suggestions am I taking on? What am I holding that may make a difference? So self-hypnosis provides individuals with skills they can use in working together with their doctors to achieve better health outcomes. This isn't something to avoid medical science, it's to use in conjunction with medical science. You take the best medical science has to offer, the best you have to offer, you put them together, you get the best result. There we go. This is just a summary. This is just a long list that I'm not going to go through, but of all the different things the research is out there that shows hypnosis is helpful for. It's like quite a bit of things. So this is a case of Tom. Now, Tom is not a breast cancer patient, but we do these groups now for all cancer patients. We haven't done the research for the whole group, but being that the fact is the general version, whoops. This is a joke, right? Somebody's doing this as a joke? I didn't do that. Okay. All righty. I told you I was jet lagged, but that really had nothing to do with that, I promise. Wow, okay. So I'll tell you all about Tom. And then when the screen comes back down, we'll look at the slides. So Tom is a lung cancer patient. The reason why I'm using Tom as an example is because Tom had, this is really bizarre. Tom had 2 surgeries, one on the right side and one on the left side, both exact same form of cancer on the right upper lobe, and a year later on the left upper lobe, same cancer, not a metastasis, new one of the exact same cancer. So he had surgery on one side, then he came to our class before he had the surgery on the other side. Same doctor, same surgical team, almost identical sized cancers. There's no way you can get a control like that. I always say to people that the people I know who do hypnosis get such better results. But it's always, we can't prove how much better they do than they would have done had they not had hypnosis. But with Tom, we can, because he had the one surgery and then he had the other. So we don't have, it has to warm up? Okay, so I'll tell you everything I remember from the slides, and then we'll make sure we can guess and see how much I got right. So Tom had the right surgery in 2014, and he came to one of our classes. He was in one class. The first class, we kind of defined what hypnosis is or isn't, teach them initial self-hypnosis technique, and then after that, we spent a lot of time teaching them about how to do suggestions. That's what the next 3 weeks are about. So since his surgery was the next Monday, 6 days after learning his first class, we quickly set up his individual appointment. And I met with him and we talked about the things he wanted to work on and made him a recording that he then listened to 4 or 5 times before that next week when he had his surgery. So the 2014 surgery, oh, look, it's up. Yay. So it's a wedge resection, right lung, August 2014 for non-small cell adenocarcinoma. I have trouble saying that when I'm not jet lagged, so. And then the 2015, same surgery, other side. So tumors were comparable sizes. We went through all these things, I think, already. Yet located in the same general lobe, same surgeon, same team. So he started hypnosis prior to the second one. Okay, so in the first surgery, afterwards, he was in ICU after the surgery for atrial fibrillation due to pulmonary inflammation from the surgery. He had a drainage tube for both surgeries. He said the pain was an 8 or 9 on removal of the drainage tube the first time, and that was while on a patient's self-administered morphine pump. He used the morphine pump often, didn't seem to help as far as he could tell. He was discharged on the 3rd day post-op, and he took oxycodone for several days after discharge. He doesn't remember exactly how many, but it was at least 4. Of course, he didn't know what day it was because he was on so much oxycodone. But, and when he got up and down, he said it was really, really painful, and he'd have to hold his side to get up and down. And even with the oxycodone, it really, really hurt when he got up and down. Second surgery was in 2015. He went directly to a regular room after the surgery. He only used the patient-administered morphine once, and he said that's when they catheterized him. And he just used 1 shot of it, and that was it. There we go. Ups, we went too far. Back. There we go. Getting up, and he was discharged the first day post-op. Matter of fact, the surgery was Monday, and Tuesday was our group. He was going to come to our group. And he said, but they were waiting and waiting and waiting for the discharge papers, and so he didn't finally get discharged until 5 o'clock, and the group was at 5:30, and it was just too much of a rush to try and get there. So he was disappointed because he was really wanting to go to the group. But he was up around right from the very beginning. He did show up at the group the next week and walked in as if nothing had ever happened. He wasn't in any pain of any kind. He had no prescription pain meds used after discharge and didn't use any in the hospital as well. Getting up and down, he said it was a bit sore. He didn't have to hold his side at all. And he was up and going much sooner. Now, so I have pictures of the scar and of the healing, which is kind of fascinating. His wife took these pictures just in September of this year. This is the right side. So this was the first surgery. I don't know if you can tell from that, but it's raised up quite a bit and it's very red. The second surgery, which was, the scar is a year fresher, so to speak. In parts of it, it's almost gone. So he felt like he healed so much quicker, felt like he was up and moving so much faster, and then the scarring really shows a big difference in the healing process between the two. He also, the interesting thing was his expectation was that this surgery was going to be horrible because the first one was so awful and he felt so bad. So he was like really dreading the second one, and yet it turned out to be so much better. So his expectations were for it to be awful, and it wasn't. And I just have a couple other quick slides here that we may or may not see. Oh, nope, okay, that was on the other presentation. I have them. I'm doing a presentation downstairs too, so that one I had to edit a couple extra quick slides. But basically just talking about how hypnosis really is empowering to patients to make you feel like you can have control and do things. So do we have time for questions?
Very quick. Yeah. Do we have questions? Otherwise we'll be super quick.
So with the breast cancer, if people were looking for them, what do they look for, like, or with any operation, what would they look for here to try and get into? You said you had a look and you couldn't see anybody.
No, what I said was there are two organizations that are that say they do clinical hypnosis. I could not tell based on the comparison of differences of how licensure and certifications may go here versus the US. I couldn't tell which was the one that I would say I'd recommend to you. So for you to look online, there's two clinical hypnosis organizations like New Zealand, Clinical Hypnosis in New Zealand. They both come right up. But I couldn't feel like I could recommend either one because I didn't really know for sure. But when you look at them, you'll hopefully know better what their credentials mean than I do. Does that make sense? Yeah. But so yeah, so I'd look for the clinical hypnosis.
What sort of things would you be suggesting for yourself while you're, don't go regularly float, and that's sort of
Say it again?
sort of hypnotism, I guess, when you float, you go into the sensory deprivation pods and you float.
Yes.
So what would you be suggesting to yourself?
Okay, so suggestions are always based on the outcome you desire. It depends on what you're working on and what you want to do.
So you just
But it's always a positive statement because the unconscious mind cannot process a negative. Don't think of a pink elephant. And there's the pink elephant. So you don't want to say don't eat, don't smoke, don't bleed, because that makes all those things come up and then you have to work harder to take them away. So you have to think through, what do I want? So I'll give you a template. So for my surgeries where I don't bleed, I didn't say to myself, don't bleed. Here's what I said. I thought through, what is it I want to have happen? So the template you could use to follow is, I told myself, the blood will flow away from the surgical field and stay in the parts of my body that need it. And when the surgery's done, it'll return in just the right amounts. So you think through, what do I want? Doesn't have to be complicated, doesn't have to be medical, you don't have to know all the big words, but very clearly, what do I want to have happen? And then suggest those things very specifically. One more?
Yeah, last one.
what's the process that you use for self-hypnosis? What process do you use?
That's longer than I have to tell you. But if you go to I was hoping to teach you all self-hypnosis, but that takes me about 15 minutes to do, and I only had 20 minutes total. So, but if you go to that article, the Induction Technique, the main one I taught them, the first one out of the three, and the one that I used with Tom, is written out in its entirety in that article.
Magic.
Okay? Thank you.
Thank you very much. And our huge thanks